continuation of the part 2 of the chapter 8, which focuses on the vitamins like compounds. This last group includes substances like choline, carnitine, inositol, taurine, and lipoic acid. These compounds are necessary for maintaining normal metabolism. So, what's the difference between these and true vitamins? The key difference is that they are not considered essential nutrients. This is because under normal circumstances, the human body can synthesize them. Therefore, a healthy adult is not at risk of developing deficiency. The need for them can increase during period of rapid growth, such as preterm infants. Let's look at the most prominent of these, choline, which is the only one with an established AI. So choline has several very important functions in the body. First, it is a part of neurotransmitters acetylcholine, which is associated with attention, with learning, with memory, and muscle control. Second, it is needed for the production of phospholipids, which are the main structural components of all our cell membranes. Choline is widely distributed in foods. Rich sources include liver, eggs, beef. The adult AI is 425 to 550 milligram per day. A toxicity is possible. The upper level is 3.5 gram. That's mean 3,500 gram per day, a milligram per day. Sorry. And consuming excessive amount can lead to a very distinct side effect, a fishy body odor as well as low blood pressure. So the other vitamins like compounds carnitine is the primary function is to transport long chain fatty acids into the mitochondria where they can be metabolized for energy. We get it from meat and dairy, and our liver is also synthesizes it. But regarding to inositol, this is found in cell membrane and it plays important regulatory roles within our cells. And the source is animal and plant food. While taurine, this is amino acids that our body synthesizes. It's involved in vision, antioxidant activity in white blood cells, and nervous system functions. It is found only in animal foods. However, lipoic acid, these compounds help with certain metabolic reactions and also functions as an antioxidant. the body synthesizes it, and it's also found in meats and liver. So the next table provides the final summary of the five similar compounds. This table near maybe summarize the five compounds we just discussed. You can see their functions. Here are the substances, the adult AI, major function, major data resources, and major toxicity and signs. You can see their functions, their major data resources, and the fact that our own body can synthesize them. Note that for most, deficiency and toxicity are unknown or rare in healthy people. The main exception, as I mentioned, is the choline. Choline, which is the only one with the AI, the adequate intake, and upper level. But the others, there is no, it's not established yet. With that memorable fishy body odor as a sign of toxicity. For the final section of this chapter, we are going to shift gears and apply our knowledge of the diet and vitamins to one of the most significant diseases in modern medicine, cancer. So, diet and cancer. What is cancer? It is important to understand that cancer is not a single disease. It's a group of chronic diseases. What they all have in common is that they are characterized by cells that have undergone damage or mutations to their genes. These cancerous or malignant cells are out of the control. So remember, out of the control. They divide repeatedly and frequently. They do not die easily, and they fail to perform the specialized function of the healthy cell they came from. As these malignant tumors or malignant cells grow, they often form masses called malignant tumors. So, malignant tumors, as a result of rapid growth, cancer cells often form masses. A particularly insidious features is that these tumors stimulate the body to form its own blood vessels, which divert blood and nutrients away from healthy tissues and into the tumors. So, this process is a major cause of the severe body wasting or cachexia that often accompanies advanced cancer. To understand cancer, we need to be clear on our terminology, specifically the difference between malignant tumor and the benign one. So, metastasized, metastasized, this is the process that makes cancer so dangerous. It's when malignant cells break away from the original tumors, travel through the blood or lymph, and invade other parts of the body, forming new tumors. While benign tumor, this is a non-cancerous mass or tumor. The key difference is that benign tumor cells do not destroy nearby tissues and do not metastasize. They are usually harmless unless they grow large enough to pass and interfere with a healthy structure like blood vessels or brain tissue. Carcinogen. Carcinogen, this is any environmental factor that can triggers these cancer causing mutation. Example include radiation, tobacco smoke, certain viruses, or specific chemicals. The next figure provides a step-by-step visual of how healthy cell can progress to metastatic cancer. Let's walk through these steps, the 7 steps. Step number one, it begins when a healthy specialized cell experiences damage to its genes, either from an inherited tendency or carcinogen. Step number two, after repeated damage, one of these abnormal cells become able to divide uncontrollably. So there is no control. Step number three, these rapidly dividing, look at this step, rapidly dividing abnormal cell form a tumor. One cell then mutates further and becomes invasive. Step number four, this invasive cell multiplies, allowing the tumor to grow and interfere with the normal tissue functions. Number five, this is the critical step, metastasis. Malignant cell break away and enter the circulatory or lymphatic system. Step number six, these cells then form new distant tumors in other part of the body. Step number seven, and finally, the tumor stimulate the development of its own blood supply, depriving the rest of the body of nourishment. So, what are the factors that can initiate this devastating process? Let's review the known risk factors. Number one, or before to nominate these factors, medical researchers have identified several key risk factors. Some of these are non modifiable, like aging. Most cancers occur in people over 65 and having a family history of cancer. However, many of the most significant risk factors are related to lifestyle and environment. These includes number one, using tobacco, exposure to some forms of radiation or certain environmental substances, consuming alcohol, being physically inactive, and very significantly obesity and having excess body fat. Let's focus specifically on the role of diet as a promoter of cancers. Certain substances in our foods and beverages are known to promote cancer development. Alcohol is a confirmed carcinogen. People who consume two or more alcoholic drinks daily have a higher risk of cancers of the mouth, throat, esophagus, liver, breast, colon, and rectum. Aflatoxin. Aflatoxin, which is a chemical produced by certain molds that can grow on nuts or grains, increases the risk of liver cancer. Processed meat. Processed meat like like martadella, corned beef, uh, these are associated with increased risk of colon cancer. The sodium nitrate and sodium nitrite added as preservatives can form nitrosamines, which are known carcinogen. Finally, high temperature cooking methods like frying, grilling, or broiling meats may cause the formation of a group carcinogens called heterocyclic amines, reducing the intake of grilled meats, especially the charred areas, may reduce this risk. Now, for the positive side, how can diet play a role in cancer prevention? The scientist or the scientific evidence is very strong on this point. High intake of fruit and vegetables are associated with the reduced risk of cancer, especially cancers of the lung, oral cavity, esophagus, stomach, and colon. Why is this? We believe it's because fruit and vegetables are rich sources of vitamin C, rich sources of carotenoids, and other phytochemicals. Many of these compounds have antioxidant activity in the body. This means they can protect our DNA from damage by free radicals, thereby preventing the initial cancer causing mutation from occurring in the first place. This leads to a very logical question. If antioxidants in foods are protective, does that mean taking antioxidant supplements is even better? The research here is complex and often counterintuitive. This is a critical point. The relationship between specific vitamins, especially in supplement form, and cancer risk is unclear and often conflicting. Despite the theory result from scientific studies have generally not shown that taking dietary supplement containing antioxidant like vitamin C or vitamin E reduces cancer risk. In fact, some medical experts are concerned they may increase the risk of certain cancers. Regarding is folate is a perfect example of the confusion. Some studies show an inverse association with cancer, while others show no effect or even an increased risk. Vitamin E is also unclear. The large scale selected trial involving over 30,000 persons found that supplementation with one form of vitamin E, alpha tocopherol, actually increase the risk of prostate cancer. The data on vitamin C is also mixed. The take home message is that the food is a protective, but the isolated supplement is not and may even be harmful. So, if we can't rely on a magic pill supplement, what is the best? What is the evidence based advice we can give for reducing cancer risk? So, reducing your cancer risk, the best course of action is to focus on the prevention through proven lifestyle steps. According to the American Cancer Society, people can reduce their risk of cancer by first and foremost, avoiding exposure to tobacco, achieving and maintaining healthy weight and body composition, adopting physical active lifestyle, and finally, eating balanced diet that limits to the intake of processed meat and emphasizes plant foods, including fruit, vegetables, and whole grain. It is the total lifestyle pattern, not one single nutrient, that makes the difference. So to bring everything full circle, let's or let's mm, maybe later to study some cases to to adopt and to be clear what is the shortage of the diet, what is the risk factor can affect or can produce or carcinogen and make cancer later on. This is the end of this chapter. Thank you for your attention and see you in the next chapter. Goodbye.